population. And that's all the studies showed when they compared to placebo. People have the same decline over time. So if someone starts off with a memory of 100, and then it goes to 90, then it goes to 80, then it goes to 70, if someone is on Aricept, their memory will go from 100 to 92 to 82 to 72 perhaps, so they're a little bit better than otherwise. So it's very non-gratifying because you don't see people getting better on it. People do better on it than if they're not on it. And that's all we can really say about it.
So it's a drug we don't need.
I have two questions. The first one is, can one's ethnicity play a role in their risk for getting Alzheimer's?
Yeah, certain populations are much more in African Americans and less, I think, in Asians, but there is a role, yes.
And the second question is, when someone is younger, let's just say in their young adult stage, and they are less limited in what they can do, are there more things that they can do to prevent later on in life getting Alzheimer's?
No. The single biggest I have a sarcastic answer, which I won't say, because the single biggest risk factor for Alzheimer's is age. So when patients come in, they say to me, "Don't get old, doc." I think, well, what am I supposed to do? But age is what is the risk factor, so really nothing you can do as far as I know.
All right, is any of the panel familiar with the development of neurofeedback, which allows you to measure the electrical signals in the brain and be able to develop a program to help the person live with it?
I'm not.
Well, neural feedback is a field that is more being studied in the lab currently. It has interesting prospects.
But
Effects.
my son is an expert in that and has been using it throughout the world over the last 10 years.
I hope he will succeed. I hope he will succeed. We all
he's very successful.
anticipate.
Excuse me. I have two questions. One, I have a very strong family. I have a very strong family history for Alzheimer's. But I have two aunts who developed and were diagnosed, say, around 60, and they both passed away fairly quickly from it. And my mom, who wasn't diagnosed till 75. Does the age at which you actually incur the Alzheimer's disease make you more or less prone, given family history, or is it just having it in your family in general?
Yeah, so the more, if you have one first-degree relative with it, we don't really consider that a positive family history. But when there's more, that is, and you're hitting upon the point, people who have strong family histories, you usually see it happening at the younger ages, in 50s and 60s, and that's a more toxic form. Fortunately, it's very, very rare, the familial form, but people do present earlier in those situations, yes.
Talking about the vaccine vaccine, in regard to the vaccine against beta amyloid, can you talk about the tau protein and how it impacts that?
Did you ask about tau protein?
Yeah.
Yes. Okay, well, we can talk about that, but I just want to address the familial Alzheimer's issue. So I guess if you have more than 1, 2, or more people in your family that have Alzheimer's, did you perform yourself a screen for the presence of mutations related to the disease?
No, I haven't.
It can be interesting for you to do that. No, seriously, I mean, it can tell you, you know what, I'm okay, let's go to continue life regularly, or, you know what, forget about everything, I'm gonna go for it.
Dr. Okun, you had mentioned that if you fall, your cognitive capacity normally declines, and I was wondering if you could explain why that happens.
Hold on, there is a mix of it. There was a person asking here earlier about tau. What did you ask about tau?
Since your vaccine concentrates on beta amyloid, does it have any effect on tau?
Oh, okay. That's a basic research question. Now, people think now that one form of A beta, which is A beta 1 to 42, is the form that causes hyperphosphorylation on tau. I guess if you ask me, then you're familiar with that. And the other form, which is A beta 1 to 40, does not do that. A beta 1 to 40 seems to be protective in the disease versus 1 to 42. The levels of 1 to 42, so 42 and 40 is just different lengths of the protein. Okay, one is a little bit longer than the other. So decreasing amyloid beta in general should reduce hyperphosphorylation of tau. But in this particular vaccine, I haven't tested whether A beta 42 changes differentially from 40, and therefore I cannot tell you whether it will have good prospects in decreasing hyperphosphorylation. And also, in particular, in Down syndrome, tau is hyperphosphorylated through additional mechanisms. Okay, so it's a little bit more complicated in this model.
Can the administration of anesthesia have a deleterious effect on a patient who has Alzheimer's?
Can you repeat that? Who's asked it?
Over here, does anesthesia have an effect on patients with Alzheimer's?
Oh. There is a unanimous, we don't know. Which is okay, you know, one of the most important things we learn in the academia and elsewhere is to be able to say we don't know. That's okay.
Could you answer the question about falls related to Alzheimer's? Is it causal or is it?
I'm afraid the short answer is we observe it, but we don't understand it. So we see that it happens, but we don't have a good understanding of why it happens.
I want to thank our panel and certainly Dr. Okun for being here tonight. We promised you an amazing evening, and I think we achieved it. Thank you all so much for being here.